Peppermint. All right, y'all, we are live and in charge on a Sunday, which is Memorial Day weekend. Fun fact, I didn't even realize that Memorial Day weekend was initially a an honoring, a memorialization of soldiers that fought in the World War One, Union soldiers that fought in World War One, and it was commemorated by initially like Black folks who had lost their Union soldiers that were not recognized in any other way, because we know that there were Black soldiers that fought in World War One that were not really fully recognized. Obviously, didn't even have their equal rights. And so the communities got together. I think might have been in Kentucky or Tennessee, but you can research that yourself. And found found a reason to celebrate the soldiers. So anyway, we are Memorial Day weekend, and I am kind of dumbfounded, gobsmacked, stupefied by a lot of the news and headlines that are constantly coming out, but particularly this week with the quote big beautiful bill that was introduced by the current administration that on the surface, for people who like don't read, they're calling it like the no taxes on tips bill, but does so much more than that. First of all, there's a real question about like how that would really be implemented. There's always a question on how bills and laws will be implemented, but if this gets signed into law, it'll make massive cuts to Medicaid, which means millions of people will lose access to Medicaid, and particularly for LGBTQ people, there are already initiatives like anti-DEI initiatives that threaten or do cut funding to organizations, hospitals, medical providers, and other things outside of the the healthcare industry that are associated with. So if you are, a clinic that provides, HIV services, or if you are a healthcare institution that provides, access to reproductive health, abortion access, contraceptives, PrEP care, which is obviously not reproductive, then your funding may be under threat and may be cut. And so many public hospitals rely on that, let alone smaller community healthcare organizations. And so I think a lot of people are scrambling to sort of preemptively figure out what they would do. Many healthcare organizations and hospitals we've seen in the past few months, just with the DEI cuts alone, let alone the funding that's going to be cut inevitably. Like there was hospitals that decided to make preemptive moves to get to shed all of their programming of anything that looked like DEI so that they could hold on to their federal funding. Surprise! Here's a cut to federal funding, regardless of whether you do that or not. So anyway, there's lots of organizations that have decided to limit their access to gender-affirming care, cut their gender-affirming care, limit their access to AIDS and HIV services and reproductive health care and abortion services, to hopefully to like send a message that we'll do whatever you want. We'll get rid of the health. We'll stop taking care of the health of these people so we can continue to receive funding so that we can take care of the health of people. I don't know what the thinking is. And there are some organizations, some people who are deciding to sort of push back against that. And I have one guest who is definitely doing that. You may have seen him on my stream before. Full transparency, he is one of my providers, and even more importantly, he's a friend and a member of the community, which it seems like people who are members of the community are the one voice that are lacking from this conversation a lot of the times. But I'm super excited to have him join the stream. He's here with a new announcement, a new initiative, and a big Pride kickoff. I'm super excited to have him on the stream. Let's welcome Dr. Rich Mineski. Hello, darling.
Hello. Thank you so much for having me yet again. So glad to be here.
Yeah, I'm excited. Let me adjust the thing so our heads are in the same height almost. That almost does it, right? Yeah. Yeah, there we go. Now we're about the same, aren't we? Same height.
I love it.
Anyway, I'm excited that you are here. Let me fix my little cushion So my booty is feeling good. I'm excited that you are here too. And, I've been like, be- because the current administration has sent signals and communication over the past few months that they were going to make cuts to, and really not only make cuts, but also it was clear, it wasn't even a signal. They were targeting the the LGBT community, specifically the trans community, by limiting access to gender affirming care on the at the administrative level, but then also just like socially saying that we are monsters, talking about us in a really demeaning way, and really sort of helping plant and spread ideas in people's minds that will give them permission to say, yeah, let's treat these people poorly. And that's happening. uh, and I said to myself, I love this country and I love all the people in it, and not all of them, but um and I love my life, but like two things that are going to make it really difficult for me to continue to lead my life in the way that I am is limitations to accurate identification, having my documents, my driver's license, my social security, my passport, and everything, my ID match who I am. In addition to, I've paid for those things. Like I've paid lawyers and attorneys to help me change my name legally, get the forms with. It ain't easy. Anybody that's ever gone to the DMV knows. Cha- it's not easy. Try doing that to every single document that you own that has your identity on it,
Mm,
let alone bank statements and bank accounts and credit cards and, just like everything. Anyway, if I would lose access to my ID and if I would lose access to my healthcare
mm,
and gender affirming healthcare for transgender people is being attacked both administratively, starting with access to Medicaid, but then also just ideologically saying that, we don't want, you know, it's mutilation and you're harming this and you're harming that and it's taking all of our money, blah, 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 blah. And so kicking people off of their health insurances and then also aiming to target and criminalize the doctors who provide these services is a plan that they have in place, and they've already started that plan. Similarly to what they did with abortion access, not only
mhm,
targeting the doctors who provide it, but then also targeting the healthcare plans that they're on, the health insurances that provide coverage for these things, and then also the facilities that actually conduct some of these services and provide these services. So that was a mouthful, but my point is, you approached me with an idea, and I'd say it was just in time. So let's talk a little bit about your connection, because I know you as a chiropractor first, but
mm.
you recently gone into a wider field of servicing the the community at large, just people, patients. Why did you do that, and why and how?
Yeah. So one, the mouthful is so important. It's really important to bring awareness to these problems so that we can really stand together and unite to say that this is not right for any human being. So I'm happy to share this platform with you and to bring awareness to things that are going on currently to avoid going further into a dark place where it could go. And a little bit about me. I started as a chiropractor. I practiced for about 8 years between New Jersey and Manhattan. And during the pandemic, I went back into nursing. I went back to school, became a registered nurse alongside my husband, who is a chiropractor and a nurse practitioner now. And my education as a registered nurse really heightened my public health knowledge. I have a very diverse education and background from being a chiropractor, being in private practice, seeing the limitations of our uh, it puts everybody in a very interesting space with our current healthcare system. It's a for-profit healthcare system. So, we see patients as a dollar sign from our livelihood in private practice to what type of insurance you have to the type of care I can provide, justifying my payment. And then there were so many inconsistencies to the provider I wanted to be, leading me to wanting to do a cash practice, which is not ideal in an economy that's struggling for the everyday person, and wanting to be the caretaker and provider for anybody who resonates with me to provide their care. So long story short, when we went into nursing, we got to do our clinicals in a 340B clinic, which is a nonprofit, could be a nonprofit safety net clinic, a community-based organization that provides free healthcare depending on the grant funding that they're tied to. And my husband Tony and I took a very big leap, and we basically retired from private practice early to create our own nonprofit clinic that focuses on HIV treatment and prevention. And now we devised an organization that gives free healthcare. And much like you started off this conversation with, where a lot of organizations are pulling back on what they're willing to provide based off the current political environment and what the country's going through, we're the complete opposite. We're giving more to our patients. We're not going to submit or alter what we're doing and the vision that we have, because we want to be the light in the dark, and we want to set an example of what people can do with the resources that they obtain and have. So that's a really big part of why we're here, what we're doing. And I'm so grateful that we made this shift. It was a big, I know you know this, but a lot of life opportunities where it's going against what is comfortable and against the grain, what you know. It's easy to be a private practice provider, in my opinion, for me. But this was such a
Mm.
leap, and it was the best evolution of myself and where I'm going in this world. So yeah.
That's really that means a lot, and I'm happy that I guess that, I can't imagine being a doctor or a healthcare provider. Of course, when I have a friend, someone I care about who I see get a cut or something, I want to help them clean it, and I'm like, oh, let me help. I know it takes a lot more than that to be a medical professional, but I often wonder, just like, I can't see myself going into the military, especially, a military that is conducting wars all over the world and displacing people from their land and robbing them of their resources. But, just in general, like, I can't imagine the bravery that it takes to be a soldier in general. I'm not
Mhm.
condoning the military or the military industrial complex that we currently have, but I don't know that I'd have it in me. However, if somebody were attacking a family member, I could see myself fighting in any way, shape, or form. And so I'm just really grateful that in a day and age where we have medical professionals and medical organizations and these for-profit corporations really that are running the healthcare system, that there are people like you that we're able to look to that we can see where the inspiration and the heart comes from. And so now here we are in this current, you mentioned the current political climate. Here we are in this current political climate. And, we are seeing funding being cut. We are seeing rollbacks being put in place. Now, look, because of the bureaucracy of all of these systems, there's a chance that we may not feel the effects of this unilaterally until a month, 2 months, 3 months, 4 months, after this particular bill gets signed into law. But of course, these rollbacks have already started.
Mhm.
So how do we survive the cuts? Like, where do we go from here? Just in general, what are your ideas in general for any given person who let's say they're on Medicaid and they, regardless of how they identify, like, how do you say in general that someone would survive the cuts? I know that we have a plan, a couple of things that we're going to talk about, but just in general for people that are listening.
Absolutely. The first thing, and I'm going to try to stay general before we go into specifics.
Hmm.
The biggest thing is really finding organizations that have resources to connect you to the answers you don't know. So I would be looking outside of your private practice practitioners, your people that you've been using with your insurance, just because a lot of private practice practitioners don't have case management resources, so they're not going to
What
be
does
able
that
to help
mean?
you. Yeah, so if you lose your insurance, a doctor's not going to be there to teach you what you need to do next in those cases.
Oh,
Um,
yeah. Yeah.
which is it's there's a lot of steps in these things, and organizations like Hug, in which I'm a part of, that's our primary goal, is to be a connector to the things and resources that you need to bridge these
Mhm.
healthcare gaps. So that would be the first thing I would do. Your local state department, health departments can be a resource as well, but that's going to be changing with these cuts as well, because our funding comes from the federal grants. So I would
Mhm.
just say that, use your resources. And if you know somebody that has access to something that you don't, hopefully they're community based and they can also help you. I would just say that the biggest thing is of trying to avoid falling in despair, of which a lot of people in our current healthcare system do fall into. Depression's a real thing, and if you feel helpless, it's hard to pull yourself out of those things. So finding somebody that can help support you and love you through the scary experience that you're going through, is the primary goal. Ask for help, if you can do anything.
Yeah, and I think that don't take for granted that these excuse me, that these resources will stay around because we may have access
Yeah,
to them now, but like not only are they making changes to those programs, but the programs themselves may be gone at a certain point. And so like starting on it ahead of time is definitely a good idea. Um
absolutely.
yeah, so that's that. So we have a plan. You started Hug Cares, of course. And I'm super enthusiastic about this because I believe wholeheartedly that what we're going to need to do is look into our communities. Like we do have this sort of like homogenized, like everything's mainstream. I should be able to go to, if I'm hungry, I can go to McDonald's in Florida, in New York, in California,
Mhm.
wherever, and another country, and have the same thing. And having that type of mentality and access, like this sort of like one world moment, is what we had been moving towards. Of course, like especially in terms of business and industrially, but that's the opposite. Like that type of system makes it easy for them to make flip turn off cuts or turn on cuts and get rid of services at the flick of a switch, like what they're trying to do. So the opposite of that is your own like community services, doctors, mutual aid, things like that that allow us to have our own resources. Honey, who they can shut off the thing, whatever. We have our own access to our own resources, kind of like a lot of people probably heard like during the Great Depression when the stock market crashed, everybody went broke except for the people who didn't have money in the stock market. I mean, eventually it affected everybody, but there were people who had hundreds of dollars in the stock market and before the stock market, and there's people who had it outside of the stock market. And after the crash, the people who had their money not in the stock market maintained their money. And so, kind of in that same thinking, we want to be like crash proof, cut proof,
Mhm.
and we're not like living off the grid, but some an organization like Hug Cares is the beginning of that, I think, because it's community based. And so we are getting ready to celebrate Pride. What is
Mhm.
it that we are going to do? Okay, so we're getting ready to celebrate Pride, and we have.
Mhm.
Well, let me before I go into that. How do people connect with Hug Cares?
Absolutely. So hugcares.org is our website. Super easy to find us there. Hug Cares is also our social media handles, so you can find us there as well. We have a text number, 321-336-7292, where you can text us and we'll follow up to give you care as well. So we're a little bit everywhere, and outreach like this, getting more visual, on what we do and what we have to offer is priceless. So I thank you for having me on here. And
Yeah.
I just wanted to double down on a note that you made about community-based organizations like Hug. The biggest support that you can do for an organization like Hug is literally becoming a patient. We are a free clinic. We provide, free labs. We help with health insurance if you're uninsured. It's a lot of resources that a lot of people believe that they're taking away from the community by taking our free resources, and it's quite the opposite. The larger we grow, is you're supporting that we need these type of resources in our communities. We're not just the LGBTQIA plus community, where we take everybody. Hug is really setting the example of universal healthcare, where no matter what your background is or who you are, we're going to see you as an individual and really give you the best care that we can provide, and not limit that potential just because we're free.
I love that. And so, if you are now, you have locations in, tell us.
Florida and New Jersey. Yes, we're currently in Melbourne, Florida, and Kearney, New Jersey. We are expanding into more clinics soon to come. I don't want to make any announcements before they are fully idolized and created. But we are expanding clinic wise, and we're also in 35 states virtually to bridge geographical barriers that a lot of people don't have access to the resources that we can provide virtually.
I think that's wonderful. This is how it starts. And so you can support, again, by sending you can join, of course, and sending the text peppermint to 321-336-7292. I'll put that up in a minute on the screen. We'll
Awesome.
put that up there. But I want to sort of ask some questions. If you have any questions for Dr. Mineski in the chat, please feel free to ask them. Uh, I have one here from Svetlana Stoli. Hey, girl, who asks, "What do you do
Mhm,
if you suddenly get a call from your regular doctor's office saying that, hey, we're calling to let you know that we don't accept your insurance any longer, and they
mhm,
don't provide any referral or direction
mhm,
uh, where to go or what to do, basically, whatever insurance you have to not to mention the uninsured. Like example, this is a long question. My boyfriend has Medicaid. Oh, my boyfriend has Medicaid. He just recently broke his finger. We went to
mhm,
the ER. They told him after all to go see a doctor to get a referral for a broken finger. But that doctor's office doesn't take Medicaid. Very discouraging.
mm. Great question. And that's an issue for a lot of people currently. Um, and the way I would go about this is twofold. Uninsured patients, in many ways, are easier to address, especially with Hug, because we'll put you on health insurance that covers your healthcare needs, including our main treatments, which would be HIV treatment, PrEP, or hepatitis C treatment. And then that insurance is an ACA plan, so you can utilize that anywhere outside of Hug. It's just to get you the medicine and the healthcare that you need. All of our services are free. Now, for patients that have health insurance, the issues from my operation standpoint, like New York Medicaid, for example, New York
Mhm.
Medicaid is very limiting based off of New York State's guideline, where they pigeonhole um, New York Medicaid to go to New York Medicaid providers. So organizations like Hug actually cannot use New York Medicaid, but we also give the option to where we can change your plan if you want to go off of Medicaid to get the services. But the
Mhm.
other thing is, and why this conversation is so important, is that if you lose your New York Medicaid, it's so important to connect with an organization like Hug, because then you're eligible for health insurance, because the United States has to put you on a health insurance because it's a special enrollment qualifier. Otherwise, if you waited, then you would have to wait till the new year to get on the new plan. So just knowing how
Mm,
health insurance works in the US is super important when we're talking about connecting to resources. Hug is about case management. So even if in this example, you are on New York Medicaid and you lost your provider and you're still on New York Medicaid, you could connect with Hug. Our case manager would help you find other doctors in your network plan. This, we don't
mm.
get anything from this, but we do not let anybody left hanging who needs resources and needs help. That's why when I was talking about before, it's really important finding organizations that can at least help you. We'll help try to find those resources for you, even if you're not a hug patient. But ideally, we could follow your health care so that we can make sure you're staying cared for, because sometimes it's a handoff. We'll give you those resources, but if you're not under our care, then we don't really know what happens after that.
I'm This is really key. I mean, you're giving some like essential information because there's a lot of people that just are. I think. I mean, we're so uninsured. Most of us are uninsured, right? So I'm going to
Mhm.
ask. I have a few questions here for people who are too shy to ask a question. This is your last call to put in a question, by the way. But this is a. I have a list of questions here that I wanted to ask you. Of course, I'm trying to like post the information and ask the question at the same time because I'm a superwoman.
Oh, fantastic.
I have a question for you. Okay, so um, I lost. This is a little more specific because some of the services that I would say, what's the difference between LGBTQI healthcare and general healthcare? The difference is, that they focus on that there is a way to address
Mhm.
issues that impact the queer
Mhm.
community. Uh, Specifically, but there are these issues impact everyone, but like
Yeah.
in lieu of your doctor asking, like for instance, I did go to sort of a basic healthcare provider to get STI testing and sexual health testing, and their assumption is that everyone has vaginal sex and is heterosexual,
Mhm.
even Miss Thing walking up in there, and they don't
Mhm.
realize that there are other ways that people have sex, regardless of whether you're heterosexual or not. There are other ways and other body parts that people use for sex, and those need to be tested as well. And I think that there's a lot of medical providers that just aren't prepared to have that conversation. Of course, they know it, but they just assume that it's not that big of a deal. They're not a lot of times won't even offer certain types of STI testing or HIV testing or
Mhm.
things like that, or HIV services. And so I think that's the difference, is that like these are things that impact everyone, we know that in the past these issues have disproportionately impacted the LGBTQ plus community, and so a healthcare provider that understands that, I would say, is providing quality, comprehensive LGBTQ healthcare. And so here's a question for you. So if somebody loses their medical or health insurance, oh, let me go to the next one. We already asked that question. Um,
Mhm.
I lost my provider who gave me HIV or PrEP care. What now?
Okay. Okay. So I'm gonna just jump back to insurance really quick because I do want
Oh,
to
thank you.
highlight Hug specifically. We just increased our patient assistance from $200 to $300. So that means if you're uninsured and you need health insurance, Hug itself will pay up to $300 a month to put you on an active health insurance policy while providing your PrEP or HIV care. So when we're talking
Mm,
about resources and what we're trying to do here, Hug is somebody that, or is an organization that's coming up and saying, okay, we know that more people need help, so we're going to provide more help. So that's just the only thing with the insurance that I wanted to address there. But as far as PrEP and HIV care and provider competence, I think there's a lot of different things here that we should really acknowledge. One, Hug, it was founded by myself and my husband. So obviously, we're part of the community. When it comes to sexual health, Peppermint, you nailed it. Even multi site testing, your throat, anal receptivity, we can have bacteria, STIs that stay there. So if you're just doing a normal blood test and urine, you have no idea about your true sexual health. And the other thing with providers, if you're going to an older provider or somebody not part of the community, there's a lot of guilt and shame associated with healthcare. So whatever stigmas and judgments your provider has, they will impose those onto you because they haven't done their own work as far as how they meet their patients. Doesn't take away from their knowledge and who they are as a whole, but any judgments on sexuality, from multiple partners to sexual practices, all of that gets tied into your healthcare. It goes into your mental health. It's a part of what you're exposing yourself to. So coming to organizations like Hug, where this is something, we're not here to traumatize people who are already struggling. We're here to uplift and to create safety, love and support, where meeting you where you're at. There are no judgments. We are pro sex, we are pro safe sex, and we're going to give you the tools to do what you want to do, and make sure you're educated and you know best of how to take care of yourself along the way. There is no shame or guilt with any diagnosis that comes out of our organization, and we'll always be there to pick you up. And then the other thing that's really important to highlight at Hug, and obviously I am biased and I will own it. My husband is our main provider at Hug. He is one of the best providers I've ever come across, and he's an HIV specialist. So that means that on top of being a chiropractor and a nurse practitioner, he has done additional training on HIV and infectious disease, so that when we get HIV patients all the time at Hug, and HIV is no different than any other disease. So if your provider is not familiar with HIV, and they're just doing a treatment that they think is best, but they don't really know, it's not their specialty, you could be at a disservice of yourself. HIV is a very complex disease that mutates, that has resistance. There's a lot of additional education. We get HIV patients all the time that don't even understand what HIV is, and this is something that they were diagnosed with, that their providers just gave them a medication and didn't give them any resources or education, just leaving them out. And that's just the complete opposite of how we handle things. There's no guilt and shame, and we're going to teach you everything you need to know so that you feel confident of being you and not seeing yourself any differently, because you shouldn't. HIV is no different than any other disease. It's very manageable. It's a completely different era, and that's where we're really trying to destigmatize everything that has to do with HIV. So if you do have HIV, or you are taking PrEP or want to start PrEP, organizations like Hug are night and day from what you could get elsewhere.
Do you, we have a question from Svetlana Stoli,
Sure.
who wants to know, do you have to lose Medicaid first, or do you reach out to Hug and get some guidance on how to deal with this better?
That is a fantastic question. So the first thing that I just want to touch on is that Hug is not an insurance broker. We do resource to a multi-state insurance broker. We'll just pay towards your health insurance policy. So I don't have all of the answers to that. What I would say is, when you do lose your insurance, I know there's a 60-day window from which you qualify to get on a new insurance plan. The other thing is, we will connect you with our partner, who is an insurance broker, to see if there's a possibility of getting you off of Medicaid, for whatever reasons. There's qualifying reasons on why you would, and a qualifying reason could be you're not getting the healthcare that you need. So basically, the marketplace will be like, oh, we could put you on a plan that will give you these resources that you don't currently have. So there are situations, I don't know exact specifics, but what I would say is come to Hug and we can investigate and see what we can do, and we'll find answers regardless to those questions.
Here's another question. I can't afford my copays for HIV and PrEP. Did you already say that? Wait,
No,
I think we already
no.
did. Oh no,
No, we didn't
I
do
can't
that.
afford my copays for HIV or PrEP medication or PrEP care. What should I do?
Yes. Okay. So again, where you get your healthcare matters. This is what Hug does. There are a lot of different things from the type of medication you're on to Patient Assistance Foundation, which Hug applies for. So that's copay assistance that's available when grant funding is there. So it keeps going on and off currently in 2025, but we're there getting all of our patients on it as soon as it's open, and we're managing when it's not.
Mhm.
And Hug also provides copay assistance. So every medication that you get through our organization, we're paying up to $75 towards your copay. And then, like I said, we also use other resources um, on top of what Hug contributes towards your
Mhm.
medicine. So most of our patients, there are always exceptions, and I can't say universally that it's not, but most of our patients pay nothing for their healthcare, including hepatitis C, which is a $60,000 treatment. It's
Oof.
an amazing, there's a lot of resources, and we also do, the other thing with healthcare is a lot of medications require prior authorizations, which take up a provider's time. And a lot of clinics and organizations don't do it because it's extra work. And where we
Mhm.
do it, if it will benefit you and your health, we will do the work that it takes to do it. So there's a lot of answers to those questions, but I know what we do here to give an idea of what you'll get at Hug.
I want to ask another question. This comes from the Alexis Elise, and I might be able to answer this, but you might be able to answer this too. How much HRT is a reasonable amount to stock up on in the event that the current administration goes after your healthcare provider in some capacity? I don't know if you can provide an official answer for that. I mean, the goal is that you can continue to see a healthcare provider, if not your healthcare provider, in spite of any cuts that the administration is going to put in place. That's part of what we're doing here, talking about Hug and talking about organizations like Hug. But I personally, it's difficult to we're prescribed a lot of times hormones are considered controlled substances, and so being able to get like 6 months in advance is difficult to do from your doctor. Even a lot of times they're prescribed 30 days at a time, depending on which hormones you're taking, of course. And so I know that there's people who nevertheless have decided to save some for a rainy day, which I think is totally a good idea and necessary, especially if you're not able to find a healthcare provider quickly enough. And we know that a lot of these changes that are impacting trans folks are already in action, right? And so one thing outside of your own means that I think might be good, when I was talking about sort of like the mutual aid minded approach, is like maybe there's a world where we ask, if you're a trans woman, for instance, and you are taking estrogen or progesterone, try to find maybe an older lesbian or an older woman who is, concerned for the community, concerned for you, who is doing hormone replacement. She's menopausal or premenopausal, and taking estrogen or hormones, but she's not being blocked from that currently until we turn into Gilead, aka the Handmaid's Tale. And she's willing to forego or like skip some of her treatments. I know this is something that I'm saying. This has nothing to do. This is not medical advice, but you can have a
Mhm.
conversation with someone else who maybe you are cares for you. Maybe someone that that you can sort of figure out a way that they can help you out and provide you some of the things that they're not taking, is what I'm trying to say. I'm not even going to ask Dr. Mineski to comment on that. Um, this is my opinion, and I heard that this is what some other people are trying to do. And this certainly, as trans folks, I grew up in the 90s when trans people, we had a whole healthcare industry that had nothing to do with the doctors and hospitals, because we were not able to get our services. A lot of it was black market, and that was dangerous for a lot of people. Were taking injecting things into their bodies that were not healthy, that were not sort of sanctioned or tested or even medically viable. Talking about like silicone from Home Depot. Sad to say, I know that there's some people that may fall back on those ways of coping, tactics, strategies. But the hope is that we don't have to do things like that. That you don't have to stock up on. You don't have to get your ask your neighbor for their medicine. You don't have to buy it on the black market or like inject something that has no label that you don't know what it is. I know that there are people that are willing to do that, and uh, not to bash, there are people who uh cared so much for the community and wanted to provide a service when we weren't able to get these services, especially in the 90s and the early 2000s. But there were also people that took advantage, just like there are in any situation, took advantage of the community, people who were in need and didn't have any other way. And so that will start to grow and increase and multiply as we move further into this. And so the hope is that we can get connected with organizations like Hug Care early on, so we can continue to get our care. And you see that the more people that there are signed up, the more patients they have, the more services they're able to provide. And so I think it's a good idea that we help expand community organizations that are accredited, that are like, legit, that are licensed, that have medical professionals that are there, so that we're not forced to get something from something in the back alley. And I think that's on the key. So that's my opinion. But I would say, if you having, whether it's in your medicine cabinet or people that you are aware of, to answer your question, I would say 6 months of any type of care or services or medication that you're able to sort of identify, whether it's in your medicine cabinet or not, is probably a good amount. I know I talked a lot. You probably don't want to say anything, but you feel free to add
I
something if you want to.
I liked your answer. The biggest thing that I just will definitely highlight and acknowledge, like you said, there's both aspects of a pendulum swing, and just really use your discernment and vet who you're going to trust with those difficult decisions, and be careful, because people do take advantage of people desperately
Mm.
wanting to maintain what they have.
LGBTQIA plus clinics are closing because of funding cuts. So where do I go for healthcare that's safe and affirming? That's a question that a lot of people may ask.
Okay. Organizations like Hug, we're in 35 states, fully virtual. So hopefully you're in a state that we can help you with. As we discussed today, all of our services are geared to our community. There's no stigma, there's no judgment. We're super convenient. We can take care of you from your home. If you have issues with transportation, we will transport you to get your labs done. We pay for your labs. We have eliminated most reasons why people can't get healthcare. And again, I'm going to say this: whether you're employed, you make a great salary, you're uninsured, um, anywhere in between all of those, you are helping our organization give care to people who are in need. And outside of our general HIV and PrEP services that we offer widespread in 35 states, we are also in methadone clinics. We're taking care of people who inject drugs, who are addicted to opioids. We're with the unstably housed in our local areas where our clinics are based. So anybody that's homeless or currently displaced, we're giving them the care that they deserve and need. And our minorities, we are looking at healthcare equity and equality, and making sure that we're doing what we can to bridge those gaps. And it starts with people who need these services being a patient. And we're just going to continue to do what we're doing. I could speak from as someone who has created this, our heart is in taking care of the people that are forgotten about, or not privileged to get the care that they need. So yeah.
Hmm. Uh, okay, here's another one we got. I'm afraid to get tested for HIV because of past stigma or shame. How do I avoid that?
I mean, a lot of these answers are just going to be back and forth. But again, we already talked about this. Providers are not equal. You know, healthcare is textbook learning and applying that information into real life. So if your provider is homophobic, if your provider is repressed and they're not comfortable with their own sexuality, that's stigma and judgment. And a lot of providers are not educated on HIV. Let's just throw that out there. You know,
Mm-hmm.
in healthcare, we are taught everything and anything so that we can kind of bounce around on what comes into the door, but that does not make you an expert at anything. So what your provider is knowledgeable about is going to preset what your experience is. And at Hug, we are HIV specialists with HIV and PrEP. And with every person that comes to us for get tested, there is no stigma. And if you were to have HIV, we're gonna catch you. We're going to teach you and normalize it so that you don't fall into what society projects at HIV. You know, my favorite patients are HIV positive patients because I get to show them and mirror to them that they are no different in my eyes than anybody that doesn't have HIV, because I think that they have experience. When we're talking about what your experience is, that's what your perception of life is going to be. So if your family are stigmatizing you, your friends, they're treating you different because of this disease, and it's so inaccurate to what it truly is, I'm going to be there to catch you and be like, this is not true. We're going to unlearn all of that. And if you are surrounded by that, we're going to keep dialoguing so that we can retrain your perspective to be accurate, because you're seeing it through a lot of wounded people who can't get out of their own way at their own detriment. So
Mm.
that's kind of what we do here at Hug.
I love that. Listen, folks, this is really I mean, it's a great thing all year long, but one thing that I want to talk about and mention is that in addition to this service that's being provided all year wherever you are, you know, you can access virtually in the States and in person in a couple of states for right now, and they're expanding. There's also a Pride kickoff that we are doing that I'm actually connected to. It's part of the reason why we're on here. I'm super excited. If you've been watching my social media, then you may have seen the flyer that I've been posting about our Pride event that we have on June 27th. Is
Correct.
that right? I think it is. Yeah,
Mm-hmm.
yeah. June 27th coming up. I'm going to post a video, a picture of it, but it's the Love Boat, darling. And I'm going to put this up on the screen right now in just a second. Talk to us about the Love Boat. Why did you want to do a party? How are we going to implement, like, why this? Why now?
Yeah, great question. So, you know, a little bit backstory. Hug was created about 3 years ago. And during this
Mm-hmm.
time, Dr. Walco, my husband, and I, we've been at other organizations that are doing these parties, you know, bringing awareness to what they do. And Hug has always been evolving and growing, and we've been just so dedicated to what we have to offer. And this year, it felt really important with everything that's going on. You know, we had a lot of patients asking, is Hug going to still be here? You know, there's a lot of fear and anxiety with our current political experience. And our mission, we were like, you know what? We want to, it's the same thing. Like, we want to, the energy you feed is the energy you get. And we want to feed
Mm-hmm.
positivity, acceptance, love, everything that Pride has to really embody, or you know, should embody ideally. And we came up with the idea of having basically a big party on a boat in New York City during New York Pride, and it's all about love and acceptance. So um, yeah, we want you to be you, fully uninhibited, no judgment, super safe, loving. That's the vibe we're going for. All Hug patients have free entry to come to the event. We want our patients to be there because we're in 35 states. We're currently doing a competition of sorts of saying how does Hug help you, and we're going to give somebody a free trip to New York City to come to the event if they're out of state or not in the
Whoa.
local area. And we've been getting a lot of, originally we set the price to do the event at $100, and we were getting a lot of people that were interested and were explaining that it's a lot of money. And although this was in conjunction to having fun, it was a fundraiser for Hug and our nonprofit.
Mm.
We decided to cut the ticket to $50 to make it more
Oh,
accessible for
wow.
everybody.
Okay.
So if this is an event that you want to be at, we're really trying to meet everybody where they're at, and if there's ever an exception to that, let me know, and we're going to meet that. It's about, I don't want anybody sitting at home wishing they were on the boat that could be on the boat that have that experience. It's really about just having a great time together. And I mean, we have you joining us for this event, so we couldn't be more excited or honored to do this together.
I'm super stoked. I'm trying to get here. Finally, I got the daggone image up that I'm gonna share onto the screen right now. There. Oh, look how small that is. Wait, this might
Get your
not be.
magnifying glass. Oh, there you
Yeah.
go.
Everybody get your eye. You go to the eye doctors, y'all. There we go, y'all.
I love
That's the picture there. There we go. There we go.
it.
So we can
Amazing.
see that it's the Love Boat. It's on the 27th. There are still a few tickets available. We have some performances. It's going to be, obviously you'll be able to get some information, and this will be a great place to like come to a pride party and then leave with the peace of mind knowing that you have access to a stream of healthcare in case yours gets cut or you want to change. Maybe it hasn't gotten cut. Maybe you just want to
Mhm.
go to somewhere new that's going to provide services for you. And so that is, of course, it's on my social media, so you all can check that out. And you all are all invited. Share this, please. Share with other
Yes.
people. Invite them. Get a group together. It's on a boat in New York City. If you live in the tri-state area, it's definitely worth the trip. I'll be on there. I'm going to be doing some cool stuff on there, and it's going to be a good time. And you'll get to learn more about Hug and all of the types of services that you definitely deserve, honey. So whether, look, healthcare is a human right and it's not a luxury. And I know that there's I was just watching a video. It incensed me by I guess a real estate person. I didn't say a developer, a person that owns a lot of um, properties, like hundreds of properties apparently, and was doing has a series of social media videos, um, bragging about or instructing people on how to make a lot of money. Apparently, he's made a lot of money. He's always taking videos in front of his sports cars and bragging about how he overcharges people who are in Section 8 housing for to provide them with housing. And it's like so insidious and so predatory. And so my point of that is it's important to go to service providers, healthcare providers, people who provide housing, who understand the community and who are not going to just see us as a quick dollar, or you know what I mean? And so healthcare, just like housing, I believe should be safety and shelter is a human right that you should have access to that. It's not luxury. You're not, this guy's charging Section 8 recipients like extra money for like $50 a month to keep the garbage disposal that was already in the apartment, $25 a month for a ceiling fan that was already in the apartment when they moved in there. That seems a little predatory. Anyway, I digress. It's not a luxury to have, should not be a luxury to have healthcare. And I think moving
Mhm.
forward, there's going to be less and less access to these types of things. So get it while you can, especially if you're queer, trans, HIV positive, if you've been dropped from your healthcare, denied, forgotten. Hug Care is a place to go. You must reach out, investigate, be prepared. You can visit the website, hugcares.org. You can text peppermint, PEPPERMINT. I'll drop it in the chat to 321. Did it go up? 321-336-7292. And yeah, you have a resource. And so make sure you go over and follow Hug Cares on all their socials. Can you say them one more time again, Dr. Rich?
Yeah, it's Hug Cares on we're on Instagram, Twitter, Facebook, and TikTok. So find us.
Thank you so much for joining us for talking with me on the stream. There's going to be more info about the event online and about Hug Cares, obviously on their socials. I'll be sharing some as well. Dr. Rich, thank you so much for joining me on the stream.
Thank you for having me. Always a pleasure.
So, folks, there you have it. If you if this resonated with you in any way, shape, or form, please, 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 please don't forget to click that link. Make sure that you, are in tune and following up on everything that Hug Care is providing. You all are amazing. I'll see you on the next one. If you're watching this, make sure that you subscribe so that you can get the next conversation that I do with a fabulous person like this. Thank you, M. Rivera. Thank you, the Alexia Elise. Thank you, Svetlana Stoli. Thank you, Nightshade Goose. Thank you, everyone that's watching. And I will see you on the next one. Please share this stream for all your friends. But in the meantime, I'll talk to you later. Bye.